I'm Dr. Chadderdon. January is Glaucoma Awareness Month, so I'm going to give you a little bit of information about glaucoma. First of all, who's at risk? Well, everybody's at risk. If I don't know anything else about you, I can tell you that your risk is less than 5%. That's really good. There are certain things that would increase that risk. The most common thing is age. People over 40 are more likely to have glaucoma. With people living longer, that stretches to increase that risk with each decade. Those people of African American or Hispanic descent are more at risk for what we call open-angle glaucoma. Those of Asian descent are more common to have closed-angle glaucoma. There are several other risk factors. Diabetes is a risk factor. High blood pressure or low blood pressure can be a risk factor. Several other conditions can be also. We have many of our patients that have family history of glaucoma, and certainly that can be a risk factor if there's glaucoma in your family. It's not a direct hereditary disease, but it certainly is a risk for you if your family has glaucoma. Several of the things that we look at when you're in for an examination are we look at how the drainage space is open or closed. If that drainage space is narrow, then you are at an increased risk. If your corneas are thinner than average, you're at an increased risk. If your eye pressures are elevated, you're at an increased risk. If you have significant nearsightedness or myopia, you're at an increased risk for open-angle glaucoma. If you have a significant amount of farsightedness, you're at an increased risk for narrow or closed-angle glaucoma. If you've had trauma or injury to your eyes in the past, a black eye or some kind of a contusion, you're certainly at an increased risk also. So there's several different factors that come into that. And so we encourage everybody, as this is Glaucoma Awareness Month, to have regular eye exams. You can determine your risk and talk to your doctor about what you can do to address that risk, or how often you might need to be seen, or if you need to suggest to other family members that they monitor their eye health also.